All right. Okay, to start, thank you for participating in Your Own Words project for the Psychosocial Aspects of Chronic Illness and Disability course at Assumption University. This project is an ongoing project for both fall of 2023 and spring of 2024 semester. We will be taking the information from this interview to develop an academic paper for Assumption University, including your interview and responses. We would like to record this interview to transcribe into a script. We may show clips of the interview in class, and our professor may show clips of this interview in the spring of 2024 class. Do we have permission to record this interview?
Yes.
Okay. Amazing. So we're going to start with our questions. The first one is, what do you do for a living?
Well, we should ask, what's your name?
Oh, yes, sure.
I'm Allison Garnon.
Awesome. And what do you do for a living?
I am a board certified behavior analyst in a public school system.
Okay. And what is your educational background?
I have a bachelor's in psychology, a master's in educational psych, and a post-grad certification in ABA.
All right. Our next question is, what motivated you to go into this career field, and how did you get started?
I was motivated to go into this career field after I worked in a school system as a paraprofessional for quite a few years. And I learned about ABA and I was really interested in it. And so I decided to do my certification with already having my bachelor's. And then once I completed that, I chose to go back and get my master's so that I could practice independently.
Did you always know you wanted to go to like work in a school?
I always knew I wanted to do something with people and probably with kids. It took a while to get there, but definitely once I started working with children, I knew that was what I wanted to do.
Our next question is, how do you diagnose and assess the children in your school?
Well, as a behavior analyst, we don't diagnose. We just provide, I'm not going to say it's treatment. We teach children socially significant skills that they need to be successful in life. But the actual diagnosis would come from a medical doctor.
All right. And then what are some methods and tools that you use?
So we do use some screening tools as far as rating scales or adaptability scales. So I often will use the ABLS, which is the assessment of basic learning and language skills. I also do the assessment of functional living skills. We'll do a VB map, which is verbal behavior. And that will often drive the kind of curriculum we put together for each individual student.
Awesome. Next question, what disabilities are most common that you work with?
The main disability I work with is autism, but I also work pretty significantly with students with emotional disabilities.
And what are some like effective methods and tools that you use for the kids?
For the students with autism, we use a lot of ABA with them. We do a lot of discrete tile teaching, which is where you're teaching each skill in isolation through repetition and errorless teaching. And for a lot of the individuals with emotionally based disabilities, we work a lot about teaching them about consequences and appropriate consequences and managing their emotions and thoughts and feelings.
What does a regular school day look like for you and the children at the school?
So I work in a middle school. So for me, the day really depends on what's going on because I do support a middle school of 600 children. It can vary from really being heavily focused with the autism classroom, depending if the students are having a rough day or if it's time where they need to get assessments for their IEPs to be due. I also would spend a lot of time working with the kiddos in the emotional disturbed classes, where we'll be down there and really helping them process through their feelings and navigating some of those tougher social situations that they struggle with. I will do assessments. I will work on their their individual curriculums. Hold on one second. Sorry.
Wait.
We do a lot of meetings. We often attend any sort of IEP meetings, whether they're IEP or 504 meetings. I also attend any sort of manifestation of their disability meetings in case an FBA needs to be commissioned, and then I would complete the FBA as part of my job.
And like kind of going off of that, you talked about how like there's specific classrooms for like the autistic kids or like the emotionally disturbed, or does your school have like special programs for those kids with the disabilities?
We do. We always have, you know, the idea is to always do as much inclusion as possible. Sometimes the students need for themselves to just be in a different classroom, but our goal is to always have them out with their general education peers as much as possible. So they might have, we have what we call as a strive room, which is our significantly impacted autism kiddos. And so they'll be in their homeroom, they'll go down to their general education peers, they'll have some classes there, but then they'll have individualized instruction in their Strive classroom, including their life skills, which they'll work on in their Strive classroom. The classroom for the students who have an emotional disability, we call it the team room, which is therapeutic educational alternative model. And so again, the kids will be out with their general education peers as much as possible. 99% of the children do not have academic needs, it's emotional needs. So sometimes being in the classroom of 20, 25 kids, or in the hallway with 25 times, you know, however many, is just simply too much for them, and they'll spend more time down in the team room where they'll work on really teaching them those skills in order for them to be successful. That program has a social worker dedicated to it as well that works specifically just with the kiddos in that program.
Our next question is, have you always worked with children?
I would, yes, always work with kids for the most part. In my, you know, early, well, maybe through my 20s, I did not. But when I was in high school and college, I worked with kids. And then after becoming a mom and staying at home for a few years, I went back to school and have been working with children since.
My next question is, what do you find most challenging in your profession?
I think working with individuals with developmental or emotional disabilities is really emotionally taxing on you as an individual. So that can be really hard because you take it personally because you really care about the kids. And it's the hardest part is separating yourself from what that child is going through so that you can better serve them. So not taking it home is probably the hardest part of my entire job.
What do you like most about the school that you're in and the profession as a whole?
I work in an absolutely amazing middle school. We have a phenomenal administrative team, and we have a phenomenal special education team where everyone is incredibly collaborative, and it's not something that you find very often. I can truly say that I value the people that I work with, and they make a job that's very difficult and can be very emotionally and physically trying, you know, worth going to every day.
Yeah.
Who are the type of people that you would like collaborate with in the school?
So typically in any typical day, I would be collaborating with the Strive teachers, the team teachers, the social workers, the speech and language pathologists, occupational therapists, sometimes a physical therapist, depending on whether or not anyone on my caseload has PT. I oversee the registered behavior techs, so they work directly under me. And then of course, building admin and teachers just, you know, throughout the day. So really we work with kind of everyone in the building.
Another question that we have is, how do you stay up to date with current terms and developments within your field?
So articles, continuing ed classes. I do have to do 32 CEUs every 2-year cycle for my license. So in order to remain active as a BCBA, I have to re-up my certification every 2 years, and that includes 32 hours of continuing ed credits.
Do you see yourself like continuing with the BCBA down the road?
Yes,
Is there any reason why?
I just love it.
That's good.
What are some personal qualities that you think sets yourself apart from some of your other colleagues?
I think that I'm patient. I think that I'm able to keep my sense of humor because it can be very, very stressful, and I'm able to kind of keep that stress away from me personally and not necessarily feel it in the moment, which seems kind of silly, but it's true. I'm very good at de-escalating escalated individuals, which is, again, something that we do all day long. And it's also the ability to know when you need to walk away and having confidence in myself to say, you know what, sometimes I'm not the right person for this job and someone else can do a better job, and knowing that it doesn't mean I don't know how to do my job or I'm not good at it, but there's times where others are better suited or in a better spot to do it, and I'm able to walk away and know that that's the right decision for the individual rather than what's the right decision for me.
And how do you handle like burnout and like self-care, like being able to separate like the school and yourself?
I don't know. I think it's something that I just do. I think it's really easy to get burned out. I don't know if it's a little bit easier now because I'm not at home with a young family anymore. I think it would be really difficult if I had to come home to little kids every single day. Um, Obviously, my daughter's grown now, so that does make it easier. And honestly, having coworkers that you get along with and can really sit and empathize with one another, and being able to, you know, say what you need to say to them without feeling like you're being judged. And really just having one another to support one another because it is a really stressful job.
And then we have one last question for you. And do you have any family members with a disability?
No, not any disabilities that I work with, no.
All right. Thank you so much.